You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. With us, we have the go-to implant dentist in all of South Dakota, Dr. Chad Carpenter. Dr. Carpenter, welcome to the program.
Thanks for having me.
Now, you brought a lot of photos, so we'll try to get to as many of those as possible. But for people that don't know your practice, like who's the typical person that's getting dental implants?
I don't really have a typical person, but the patients that come in to talk about implants tend to fall into two categories.
Okay.
The first category of people, they have teeth. They come in, a lot of times their teeth are broken or worn down. Sometimes they have pain, swelling, or infection. So other symptoms and things they complain about are bad breath.
Okay.
There can develop gum infections around people's teeth that can give them kind of an odor.
All right.
Oftentimes I'll hear a complaint from a spouse that may come along and say, yeah, you know, his or her breath has gotten really bad over the past few years. Some people have loose teeth, and so they feel like they can't even bite into anything anymore. The most common thing I would say is just they've noticed the appearance of their teeth has degraded. Most of these people feel like they're going to end up with a denture.
Okay.
And a lot of them don't want that. And so they've delayed the inevitable, which is going in to talk to the dentist about an option. And so we take patients that have problems like I described, teeth in their mouth that are bad. And in one day, we wiggle their bad teeth out.
Okay.
And they leave that day with teeth that do not come in and out in their mouth.
Very nice.
So that's one group of patients. They have teeth. The second group, you asked about who's the typical patient.
Okay.
The second group of patients, they already have a denture. And so, you know, years ago, they had all their teeth extracted. Sometimes they have top and bottom dentures. They're having to use messy glue. They're gluing their teeth in. Sometimes they don't want to go out with friends at a restaurant because they have to order soup. Salads are impossible to eat. They can't eat nuts. Strawberry seeds get caught up underneath their dentures, and their bone has maybe resorbed underneath. They're getting cuts and sores in their mouth. We've all seen funny clips on TV of a politician talking and their denture falls out. That happens to people.
Is that right?
It's very embarrassing.
So what do you do for these people?
So this is awesome. So my patients with dentures, on the day of their procedure, they come in with their dentures, and when they leave that afternoon, they have new teeth fixed in their mouth on top and bottom that don't come in and out, that we 3D printed in the next room. It's absolutely amazing.
Is that rare, or that happens every once in a while?
That's what we do day in and day out. So it's amazing the transformation that happens. Being able to smile, being able to eat the foods that they want to eat, being able to bite into a chewy caramel roll without their teeth dislodging, being able to talk and speak, being able to sing in church. I've had patients talk about losing the ability to sing because they were worried that their teeth were going to come out. So being able to have teeth that don't come in and out, it makes a big difference.
Now, correct me if I'm wrong. The way dental implants are typically done is you go to one office where they do the dental implants. Then you go to another office where they put the teeth on top, and a third office to maintain them. You do all three parts. Is that why you do it so quickly?
That's one of the reasons we do it so quickly. The traditional way would be you'd have to go to multiple different places to get it done. But with the training that my team and I have done, we're able to achieve all three of those things that you said in our office. The other reason we're able to do it so quickly is we have 3D printers in our office. So right down the hallway.
And those make the teeth?
They do.
Okay.
Yes, I have a designer that designs exactly where the teeth are supposed to be so they look and function perfectly. Then I have a laboratory technician, that's what we call them, that makes the teeth on our 3D printers. And those get put in the same day as the teeth get wiggled out or as the implants go in.
So when we said at the top of the show, no more dentures, that's not an exaggeration? I mean, is that...
It's not an exaggeration.
Do you think that's the future of dentistry, like 20 years or 50 years, dentures as we know them today won't exist? They'll all be attached to something? What are your thoughts?
That would be amazing. You know, having no teeth is considered a disability by the World Health Organization. And so if we could eliminate edentulous and eliminate the pieces of plastic people have to wear around as a replacement for their teeth and give them natural filling teeth that don't come in and out, I mean, that would be amazing vision.
I'll put you on the spot here. So if somebody's watching this, now, of course, you'd have to have openings on your schedule. Somebody wearing a denture, 2 days from now could have upper and lower teeth that don't come out. Is that true or an exaggeration? I mean, if everything works out.
If everything worked out, I mean, I had a patient that was getting married, and she had worn dentures top and bottom for quite a while. She was very unhappy, but you know, we live in South Dakota, and so we're not complainers.
Okay.
And so her fiance saw that she wasn't happy, and so he said, we got to do something before the wedding. And so I looked at my schedule, and our office is busy, right? We have a lot of amazing patients that come in, but we always have room in our practice for great patients. And if someone's on a time crunch, I'll move heaven and earth, especially for something as important as a wedding, an anniversary, a vacation, a graduation, even a baptism.
Okay.
We make it happen for people. And so we design the teeth, we find a spot in our schedule, and we insert top, and in this case, bottom teeth that don't come in and out in the same day.
Is that right?
Absolutely.
So like 2 visits in her case?
So typically there's 3 visits. So on the first visit, I get to meet the patient gets to meet me.
Okay.
We take a CAT scan of their jaw, and we determine if they're a candidate for the procedure.
Okay.
Once they find out that they are, and that's often very exciting. A lot of patients come in and they think that I don't have enough bone for this, I'm not going to be a candidate. Almost 100% of the time, I have a way to help them.
Okay.
And so once we've determined they're a candidate and everyone's excited, they come back for a second visit. That's where we design how we want the teeth to look and how we want them to be able to chew. So we get everything dialed in on that day.
Now when you say, I'm going to interrupt you for a second, but when you put them in a computer in a way, it's designed on the computer based on their face. Can you elaborate on that?
Absolutely. So there's all different kinds and shapes and sizes of people that have tall, narrow heads, round heads, skinny heads. And so every single design that we do is customized to the patient's face.
On a computer?
Yes.
Okay.
So I have a team of digital designers, and what they do is they design smiles. They design teeth, and that way on the day of the procedure, we can insert those teeth, and they're going to be almost exactly perfect how we want them, almost every single time. And so after that's completed, and we have the design done, that's the exciting part, is the day of the procedure.
Okay.
And so on that day, the implants go in, and the new teeth get installed. They don't come in and out. They're permanently attached to our dear patients. And oftentimes, you know, some people are worried about being nervous or anxiety or discomfort.
It does seem painful.
Well, we typically sedate our patients if they want that.
Okay.
And so we keep them completely comfortable during the procedure. So they're not awake, they're not part of the team.
Okay.
And in that fashion, if they want to, they can just go to sleep. And when they wake up, all the scary stuff's done. On the next day, you know, they're recovering, they're able to start eating again, and sometimes they're taking some over-the-counter medications to help control any discomfort that may come up.
Okay.
But the patients tend to do very well after this procedure.
Now, you said to me on the phone that when it's all done, that they were, I'm paraphrasing you, but that they worried so much more about that it was going to hurt and things like that, and they're always surprised that it was easier than they thought it was going to be. Is that right? They say that?
Oftentimes patients do say that. You know, with any medical procedure, including dental, there's going to be some healing and recovery time. But we give our patients medications, oftentimes through an IV during the procedure, or even over-the-counter Tylenol and ibuprofen.
Okay.
And it helps to control the discomfort. Usually there's no need for heavy-duty pain control medications. We do it in a very gentle way, and it's done in a very expedient way. So it's not a 12-hour long procedure. We get it done quickly and get everything very solid in there, so the gums heal very quickly.
Okay.
And it tends to be very comfortable.
How old can you be to get this done? Like, what's the upper range?
Well, the oldest patient I've ever done this on was in their 90s.
Why would a 90-year-old want to do this?
They want to do it because they want to eat and chew. I mean,
Okay, that's fair.
Don't think that just because someone's a little bit older, they don't have the same wants and desires that a younger patient might want. And so this particular patient, she shared with me, she had been thinking about doing this for 10 years. So when she was 80 years old, she had these terrible partials that she had to wear. This is a removable piece of plastic with metal hooks on it. It hooked onto her teeth. They didn't look good. They moved around. They were cutting into her gums, causing her all kinds of pain. They didn't look good. Her grandkids and great-grandkids were asking her questions about them. But she thought, I'm 80 years old. I don't want to do this. I don't want to spend the money now. I'm too old. I don't know what my health's going to do. So she kept telling herself excuses. And at some point, 10 years down the road, she realized...
At 90?
At 90,
okay,
I'm in about the same health that I was 10 years ago. I don't want to live the rest of my life like this. And apparently she talked to her son who brought her in. And I met with her, and her biggest concern was, they told me 10 years ago I didn't have enough bone to do this, and I was going to have to get dentures, which she did not want.
Okay.
I took some x-rays, and I told her, you have enough bone to do this. You're absolutely a candidate for this. And she said, I want to do this.
What do they like more? The way, like with her, do they like the way it looks, or do they like what they could eat?
It's funny that you asked that, because some of my patients that came in and they say, I want a better smile. I don't like how my teeth look. And so in my head, I think, okay, they're doing this for cosmetic reasons, right? They're the ones that come back in and they say, I'm eating so much better. I was eating a very bad diet. I had to eat soft foods. I had to eat, breads and processed foods all the time because I just couldn't chew up good, healthy food. We take it for granted being able to eat, a raw carrot or
so
fresh
she could
fruit.
eat a raw carrot at
Absolutely.
that age? With her front teeth, or she has
Absolutely.
to be careful? Is that right? They can eat whatever they want.
I told her, eat whatever you want. No restrictions. Steak, almonds, carrots, salads. Even, I mentioned Christmas time, butter brickle. I said, you can eat that. It's okay. These teeth are made of zirconia. It has the same compressive strength as gold, but it looks beautiful. It's so strong. What she told me was that she wished she would have done it 10 years earlier.
So she lost out on like 10 good years of eating.
She did.
Okay.
But we're not too sad about it because she's in a great place now.
That's very, so if she's 90, so when a 65-year-old goes to your office and says, Doc, am I too old? Not even close.
No. I mean, there's a weird psychology that happens with us when we get older. I don't fully understand it, but I have helped so many older people that come in and they think they're too old. And when I look at their x-rays, it's like, if you want it, it can happen.
Do you ever, on a consult, you're talking to a patient, you're hearing their hard luck story, and you start getting excited because you know how good it's going to be? Do you see the end result in your head when you're talking to a patient?
So before we start a case, we need a blueprint to follow. I have to have the final result pictured before we journey to their new smile.
Okay.
So absolutely. I can see it in my mind's eye. I can see the potential. I can see what their life's going to be like.
Really?
And it's exciting.
So it's more than just teeth.
It's more than just getting teeth. Dentists like to talk about smiles. And a smile is very important. If you look at a Men's Health survey, what it found was that the number one thing that someone looks for in a spouse is their smile.
Okay.
And so when you're walking around with your lip down, or you don't like something about yourself, it's hard to be your true self.
It holds you back.
Exactly.
So that all goes away.
It can.
Do you see personality changes, like when it's all done, they're coming back in for their cleaning, and they're almost unrecognizable with how they act? Does that ever happen?
We have seen many patients that walked in timid. They walked in with their head down. They might have been anxious, embarrassed, ashamed. And when we wiggle their teeth out and put new teeth on the top and bottom that don't come in and out, that look great, they know that they took a step towards reclaiming their health.
It's nice.
And so absolutely it changes their personality. And in fact, I think it just lets their true self come out. They can be themselves again.
Like they're back.
Exactly.
So you have brought in the lab where you make the teeth right there.
We do.
Is that right? Do you think that's why the teeth look better? Like you're more in control of the process?
So
I don't want to put words in your mouth, but is that one of the reasons?
That's absolutely right. So we control everything that happens. And so, if something doesn't go right, oh, the lab screwed it up. It's like, no, this is all on me. It has to be right. And I'm going to be able to control everything from the start to the finish.
Now I got to ask you this question. We're short on time, but snap-in dentures on top of dental implants, it's very popular here in California. You're not a fan, you told me. Why?
I want my patients to be happy. And a lot of times with a denture, whether it's a snap-in or a regular denture, they're not happy. And to make my patients...
Is it lots of maintenance?
There is maintenance associated with them, but you still have a bulky piece of plastic that's in your mouth. Oftentimes, the roof of your mouth's still covered. Sometimes with the snap-in, we can eliminate that, but it's still thick and bulky. It can move. There's maintenance. The other problem I see is sometimes snap-in dentures push on the implants. They can cause bone loss over time. And so if a patient's
they could break.
They could break, or worse, one of the implants could fail. It doesn't mean that they will, but I have seen a lot of patients with especially upper snap-ins start to lose bone around their implants. That means the implants could get infected or become loose, and they've invested all this time and resources into this, and they could have to have it redone. And so I have treated several patients that had a snap-in.
Could you convert them over?
I did.
Okay.
So they came in with their snap-in denture that was failing, and I had to remove their bad implants and put new ones in, and then I put teeth in that don't come out.
Do they ever say, I should have done this in the first place?
I've had patients say, I wish I would have started without a denture.
Okay.
But,
we were in the green room, and I did some research on South Dakota and all of these low prices, and it looked like they were getting new teeth on implants, and you explained to me that those are snap-in dentures.
So it's
kind of misleading in a way, right? Or no?
Possibly. There's a big difference between a snap-in denture and teeth that are permanently attached to the implants that don't come in and out.
So that's the way to go.
It's two different things. The top recommendation for my patients, I want to make them happy. I want to give them something that's going to last, that's going to look great, that's going to feel great, that they're going to be able to eat whatever they want. It's not going to require a lot of maintenance. And so the way that I can do that is by putting in teeth with no dentures, that don't come in and out.
And one of the last things on my list to ask you is the cost. That dental insurance doesn't cover this. Medicare, Medicaid doesn't cover this.
That's true. But the thing is, in today's world, expenses like this get financed. And
people are financing these procedures?
Absolutely.
Half of them?
Over half my patients. How can you walk into a dentist and just whip out your checkbook and write a check for something like this? It's very difficult. And so we have to make it affordable, or no one will do it. And so we have lots of options for people.
You have to have okay credit, though, to finance it. Is that correct?
You do have to have decent credit, but we also have lenders that accept co-signers, and we have different lenders that have different criteria. So if one place doesn't work out due to some maybe mediocre credit, we have other lenders that oftentimes we can get people financed.
Okay, good. Now, your final message to the two groups that could benefit the most, according to you. You got the one group, which is they're wearing a denture. The other group, their teeth are really bad, and they feel like they're going to end up in a denture. They heard what you have to say. Maybe they've watched the whole thing. But for whatever reason, they're scared, they're skeptical, whatever. What do you say to them?
You can't make a decision unless you know your options.
Okay.
And so I would say, come in, get an x-ray, hear about your options, and see how we can help.
That's very nice. One of the things that wasn't mentioned was, that I think you wanted to bring this up in the show, is that you don't only do dental implants. That means you'll save teeth when you can.
Yes.
In fact, you told me over there, you said some people come in and say, Doc, just take out all my teeth.
It's true. Some people come in and they think they're going to lose all their teeth. And after we do our evaluation, their teeth are actually not that bad. So we can save them a lot of time and money by saving the teeth and just rebuilding what they have. And the end result is beauty and health without dental implants. So as a general dentist, we have the ability to treat people in different ways, sometimes without dental implants.
Does that happen a lot? where people self-diagnose and think all their teeth have to be removed?
It does.
And they don't?
It does. Yeah, I had 2 patients last week that thought they came in for implant consultations. And I said, you might get all your teeth pulled and get implants, but it's not going to be here. I'm not going to do that to you because you don't need that. We can do it a lot less expensively, more conservatively, and get you to the same result that you want.
If somebody wants to make an appointment with you, do you prefer they go online, make an appointment there, or just call your office?
Just call my office. My receptionists are absolutely amazing. They'll take great care of you. Give us a call. We'll get you an appointment.
All right. I want to thank you for coming to the show. Good stuff.
Yeah, thank you, Randy.
Appreciate it. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.